That little red thing you see in the corner, that's my baby. That's my chubble. You can keep sleeping, baby. You can keep sleeping. I just gotta say in advance that I am not a professor. I am a nursing student who really enjoyed what she learned this semester. It's all because of my professor. She was so knowledgeable. She taught everything step by step, like she was the one who invented the disease. And I just got so passionate about it, and I put little shortcut notes that I just want to remember. And hopefully it will help you too if you're a future or current nursing student. Well, let's get to it. Let's get to it. I got my handy dandy good notes and my notes in it. Or should I say, great notes. In MedSurg 1, you get to learn about all these diseases, especially if they're common. These are the main ones that I kind of took notes of that were shortcut. Holy crap, what's the difference? What am I supposed to do? So I did what I could. I had a lot of notes. I'm not gonna go over those notes because I'm not currently learning this. I learned this. If I'm missing stuff, have mercy. Have mercy. We're gonna be talking about DI versus SIADH. Then we got hypothyroidism versus hyperthyroidism. We're going to be talking about probably your favorite electrolytes. First, DI versus SIADH. DI or diabetes insipidus. This is when there is no ADH. That is the water-saving hormone. And because they don't have ADH, they pee a lot. So that causes dehydration. In nursing, when you are dehydrated, you're confused. You get a headache, big time on the brain. Because that is all happening, it will lead to hypernatremia. Hypernatremia is a lot of sodium. There's extra serum sodium, but there is decreased urine sodium. Don't get confused, okay? Don't get confused because this is where it almost lost me. It almost lost me. The sodium in your pee is different from the serum sodium, okay? When that's happening, you get to have a low dilute urine specific gravity. The lower it is, 1.005, the more dilute it is. The higher it is, the more salty it is. 1.0035 was it? I don't have the specific numbers, but I think that's the number. Treatment for this is desmopressin, which is basically the synthetic ADH. This can cause hyponatremia if it's too much. Thiazide diuretics, because when you do thiazide diuretics, it seems kind of hypocritical at first because thiazide diuretics, they make you pee more and this person is already having a lot of pee. What happens here is you will lose a little bit of water/salt to trick the kidneys. Once your kidneys are tricked, it's gonna think that you're dehydrated. So when it thinks that it's dehydrated, it will hold on to more water so you can pee less. Time to move on to SIADH, which is the complete opposite. It has too much ADH, and ADH is the water-saving hormone. Don't forget that. Because you're saving too much water, you're retaining water. The body then becomes hypervolemic. Basically means it has too much fluids, and when you have too much fluids, you can have hyponatremia, too little sodium. When you're hypervolemic, you also get crackles in your lungs. The serum sodium is decreased, but your urine sodium is up. And because your urine sodium is up, your specific gravity for that pee is high. The treatment for this would be hypertonic saline if the sodium is really low, tolvaptan, conivaptan. These help increase the sodium. A simple one is to just restrict fluid intake because you already have too much fluids. Hang on. Now we got hypo versus hyperthyroidism. Let's get excited here. Hypothyroidism is when you have decreased metabolism. You don't have enough iodine or tyrosine. These are the ones that make the thyroid hormones. Because there's not enough of those, you get paresthesia and your heart rate is decreased. When that happens, you get dry skin, you might be constipated, and you can't poop. You will have weight gain, you will have edema, and you might become depressed. You cannot tolerate cold. And this is the one that can lead to myxedema coma. So this is when your blood sugar is low, your temperature, your respiration rate. It's scary. All right, be careful. The common disease that's related with hypothyroidism is called Hashimoto's thyroiditis. And that's when the antibodies are attacking your thyroid tissue, and that's why you're not making enough thyroid hormones. The treatments for this is levothyroxine, your thyroid hormone replacement, and you have to do this lifelong. You can also increase your fiber and your fluid intake. That's to help the constipation because, you know, hello. When you are going through these two things, for example, if you need more sleep, like you're just so tired, you're constipated, you need probably a higher dose of your thyroid hormone. But if you're insomniac, you can't sleep, and you have diarrhea, which is the opposite of constipation, you need a lower dose. And of course, you predicted it, hyperthyroidism is the complete opposite. It's increased metabolism, you have too much thyroid hormones, and you have increased deep tendon reflex, you get tremors, your heart rate is too high, you're hyper. Your blood sugar is also high up there, and like I said, you're hyper, okay? You're hyper. Instead of being dry, this one is sweaty. Your skin is really smooth because you're sweaty, and you have a lot of weight loss because you're hyper. You cannot tolerate heat. But this is the one that stands out with the exophthalmos, which is when your eyes are basically bulging out. And you also get the eyelid lag. The common disease for this is the Graves' disease. Antibodies attack the TSH greatly, so which that causes the excess thyroid hormone. So treatments for this will be, okay, there's actually a lot. Let me pause real quick. First, thionamide, which is metamazole. This is really the main one you need to know. That is what they will always mention, along with PTU. PTU really basically decreases the blood flow to the thyroid gland, so it can decrease the thyroid hormone. Propranolol, it doesn't do anything to the thyroid hormone, it just helps decrease the heart rate because your heart rate is really up with hyperthyroidism. And then we got calcium gluconate for hypocalcemia. That's after post-op. Okay, that was redundant. That's post-op. Increase your calories because you are losing a lot of weight. Do we even want to go to electrolytes? Electrolytes was literally heck for me. Sodium. When you think of sodium, think of the brain. Some causes could be diuretics, having fluid overload, or sodium loss from vomit, diarrhea, or sweat. Some signs, confusion and seizures. Brain. Your deep tendon reflex is weak, it's decreased, and you have a lot of diarrhea. Fluid loss, you will have high heart rate, low blood pressure, but fluid gain, like fluid overload, is high heart rate, high blood pressure. Some treatment for this is hypertonic IV, that's only if it's really severe, and normal saline, so if it's like mild. Causes for hypernatremia, dehydration, hyperaldosterone, and fever. Some signs again include confusion, and they're probably agitated. Deep tendon reflex decrease still, so they'll be weak and twitching. Treatment, normal saline, but also D5.5 normal saline. Diuretics like furosemide. Potassium, think about the heart. This is really the main lab you'll be worrying about in nursing school and clinicals. Potassium. Hypokalemia. Causes can be diuretics, vomit with diarrhea, and increased insulin. Signs can be coma and constipation. This constipation can be paralytic ileus if it gets worse. This one, you have irregular heart rate, but also you have decreased blood pressure. More common for hypokalemia to have an increased heart rate, but it's usually irregular. Treatment for this one is spironolactone. Spironolactone saves potassium. If diuretics is needed, that's the one you gotta use. You also can give potassium supplements. Watch the heart rate and respiration rate because potassium, heart. Hyperkalemia causes can be tissue damage and renal failure. Some signs can include tingling on the face, feet, hands, and diarrhea. For hypokalemia is constipation. For hyperkalemia is diarrhea. Decreased deep tendon reflex as well for this one. This one is double low. Low heart rate, low blood pressure. Treatment is insulin with glucose that basically moves the potassium to the cells. Diuretics, and don't forget you should do EKG because it's the heart. Calcium, we love our milk. This deals with the muscles and the bone. Hypocalcemia, which is low calcium. Some causes for this is postmenopause. You already know. Hypoparathyroid and pancreatitis. Some signs that include with hypocalcemia is tetany, C and T signs. Chauvet, Steck, and Trousseau signs. I don't have it here, I just said C and T signs. It has high deep tendon reflex, so they get brittle bones with spasm, high heart rate, low blood pressure. Treatment for this is, of course, giving vitamin D, reduced stimulation, and calcium gluconate. Up that calcium. Hypercalcemia. Hypercalcemia is too much calcium. Some causes for this can be thiazide, dehydration. Some symptoms that you will see is confused, might be tired, and they might be constipated. You get low DTR. You also have irregular heart rate at first. This one's kind of a little confusing, but it's high heart rate and then low heart rate. Treatment is normal saline, which helps flush out the calcium, and of course diuretics like furosemide, not thiazide diuretics, okay? No. And we got calcitonin as well, or biphosphonate, which stops calcium release. One more electrolyte left and this video is done, okay? Don't you worry, you're not suffering anymore. Magnesium. Think about the nerves and the heart. Low magnesium or hypomagnesemia, some causes can be diuretics, malnutrition, and steatorrhea. That one basically means fatty poop. Some signs that you will see with hypo: confusion, insomnia, so they can't sleep. The C and T signs come back, which is the one in hypocalcemia, and also tetany. This one has high deep tendon reflex, so they get tremors and tingling, high heart rate, high blood pressure, double high. Treatment for this is magnesium replacements or supplements, of course, because it's hypo. You can also give magnesium sulfate if you have seizures, especially if it's severe. Of course, make sure you check the potassium and calcium levels too, because they all relate with magnesium. Hypermagnesemia, or too much magnesium, some causes can be renal failure or too much antacids or laxatives. Some signs can be you're drowsy, you have coma, and you might have trouble breathing. This is on the severe side. The deep tendon reflex is the opposite for this one. Double lows for the hypermagnesemia, double lows. Low heart rate, low blood pressure. Hypo is double high, hyper double low. Treatment will be giving loop diuretics, try to pee that out. IV calcium gluconate. That one, what it does is it protects the heart from the depressant effects. It's only protecting the heart. If it's really severe for any of these, get dialysis. So some tips I have for this is hypermagnesemia vitals is also kind of equal to hyperkalemia vitals. Potassium, magnesium, and calcium work together. Thiazide diuretics, they increase the calcium, but they decrease the potassium. And loop diuretics, they decrease everything. That is all. Oh my goodness, my brain is already like almost fried just remembering all this. How did I do it? It was all gone. Those are just some things that I really enjoyed learning about. I have more, but those are the main things I kind of want to remember. If this helps you, I really hope it does. That'd be fantastic. If I'm wrong with some things, point it out. Please do. I'm not learning these right now. I learned this a long time ago. That's the knowledge that I gained and I'm sharing. If you enjoy videos like this and you enjoy just me talking about stuff in nursing school or anything in general, just let me know in the comments and I will definitely do some more for you guys. Until next time, I'll see you on the next video.